audience of Catch Me, presenting the Catch Me tools for atrial health professionals and patients for you this afternoon. So the Catch Me Consortium is funded by the European Union, and the ESC is a partner. The major aims of Catch Me are to identify major health modifiers causing AF, ideally the major health modifiers, develop clinical tools to personalize atrial fibrillation prevention and management, and underpin and guide future strategies to prevent, diagnose, and treat atrial fibrillation in Europe. In a nutshell, there are 5 work packages in the Catch Me Consortium. Work package 1 deeply analyzes main changes in atrial tissue. Work package 2 analyzes main changes in blood and ECG. Work package 3 combines all these analyses of a lot of studies to determine the main atrial fibrillation drivers. And work package 4 will then generate and validate, hopefully, an atrial fibrillation classification. And in work package 5, we strive for better communication and communication for better atrial fibrillation treatment. Now, we've heard a lot about patient involvement. Patient involvement is important. Engaging patient is actually a principle that's common to professional standards across the world. And just to quote this, establishing rapport and trust, formulating a diagnosis, delivering information, striving for mutual understanding, and facilitating a shared plan of care. And it is very difficult if there's not much time to make sure that you do this as much as you want to, and hopefully the Catch Me tools can help there. Healthcare apps can actually improve outcomes. So this is just a collection of some smaller studies, and Deepak is currently writing a review on these healthcare apps. They have shown an improved outcome and changes in lifestyle, which can be very difficult to achieve. And of course, integrated care of patients with atrial fibrillation is now implemented in new atrial fibrillation guidelines from 2016, so we can empower patients to become active partners in their care, improve communication between patients and their healthcare professionals, support guideline adherence, and that means also therapy adherence, improve efficiency of the care processes. So the concept of Catch Me smartphone and tablet apps is closely aligned to these new atrial fibrillation guidelines, support the healthcare team, involve the patient, and integrate the atrial fibrillation care. So developing such an app is not something that happens at once. It has been going on for a while. It is a continuous process, and it will continue for another 2 years. We started with a task group, and a lot of these colleagues are here in the room today at the meeting at the ESC in London, and there were structures made, and there was a lot of beta testing done, and thanks to all of those who helped with beta testing. And then it was released. The Catch Me tools were first released in the ESC AFib pocket guidelines at the ESC in Rome, and were downloaded a lot. But this is still a continued process. So since then, much has happened. Most of all, we've been working further on the patient app. So it will be called My AF Patient App. It will be a standalone app. So the patient has access to the atrial fibrillation information. This can be on atrial fibrillation, cardiovascular diagnostics, risks, and treatment options. The patient enters and stores information. This can be done before seeing a health professional. For example, symptoms, medical history, but the patient owns the information. Then the patient can transmit the information to the healthcare professional. The patient can choose to do so. The patient can choose to submit the information securely. It will be saved on a server at an academic institution to secure this information. So the My AF Patient App has patient education, which is designed for and by patients. So importantly, the text and the images, they were collected in a way that they don't imitate the patient. They're easy to read. They were provided by the British Heart Foundation, by atrial fibrillation patients themselves, by ESC guideline task force, by the EHRA and AFNET patient websites, and it's all closely aligned with the 2016 AF guidelines. So the patient can transfer the health data to the healthcare professional app, and he can choose so. So please now download the Catch Me apps in the Apple Store. And if you no longer listen to me now, I will not feel offended. If you now start to download, let's see what the Hard House internet can do. So you will have to look in Apple Store or Google Play, and then you need a password. It's a PT demo, patient demo for this one. This is just an example of an image provided by the British Heart Foundation. It's just number 3 and 4 for how to tell a patient to take the pulse. I think it's just really beautiful. Then there's the atrial fibrillation health professional app, which now has an integrated treatment manager. So it's different from what you've downloaded during the ESC in Rome. So the healthcare professional can now fill in or access the information transferred by the patient beforehand. Then you can receive individual treatment recommendations covering all 5 domains of AF treatment. It's all aligned with the 2016 AF guidelines. And then you can transfer the data safely from and to the patient and also to other professionals in the team who are involved. So please download the Catch Me app here. So there are 2 different standalone apps. This is the healthcare professional app, and both is HCP demo for healthcare professional demo. So if you can do this, it's on the flyer as well, which was shown to you. If this seems to be nerve-wracking, if you just put in Catch Me, you might get to all kinds of different Catch Me things which you should maybe not follow if you don't want to risk your internet history cleanness. If you put in ESC Catch Me, you might get there quicker, but you don't get it in the pocket guidelines now because it's standalone. We really appreciate your feedback on this. So today in the audience is someone from Brookbayer, Natalie Blanc. So you can talk to her. You can try out the app on devices which are provided. Best thing ever, take your own phone, and sort of the older your phone, the better. You'll see whether it will still work on this, and then otherwise they try to adapt it to it. Please use the information feedback button. This will go directly to Björn Brookbayer company. And please also copy in Winnie Chua, who has in the last months collected your feedback. Winnie, maybe could you stand up? You can also talk to Winnie and say what you liked and what you did not like, and that will definitely help. So thank you very much for your feedback. Thank you very much for everyone who helped.